Do you have chronic low back pain? If you have been doing your physical therapy exercises such as supine toe taps or planks for weeks and yet the pain just won't go away, this is a good time to start learning how to do side planks. Today I will show you 3 levels of side planks that are beginner friendly and that could really help to further stabilize your lumbar spine. The first exercise is side plank against the wall. This is the easiest version of side planks. Stand next to a wall, bend your elbow, and put your forearm on the wall at the level of your shoulder. Take 1 to 2 steps away from the wall until you feel your obliques engaging. Make sure to keep your back straight. Hold this position for up to 30 seconds and then come back to standing position to rest. Then switch sides and repeat. Make sure to keep breathing throughout this exercise. If you hold your breath, you will get tired faster. The second exercise is side plank on knees and forearm. This one is a lot tougher than the wall plank. Start by sitting on the floor on your hip and support your upper body with your forearm. Bend your knees to about 90 degrees and stack your knees together. Lift your hips up away from the floor and push your hips forward like a hip thrust. Hold this position for up to 30 seconds and then come back to the floor and rest. And then switch to the other side and repeat. If you cannot hold this position for more than 1 second due to weakness or pain, it is okay to just practice lifting your hips, push forward and back down immediately, and then repeat for 5 to 10 repetitions until your obliques and your hips are strong enough to hold the side plank position for a longer period of time. If your pain increases with this movement with each repetition, maybe you're not quite ready for this exercise yet, and you can go back to the first exercise and practice that for a couple more days until your obliques are strong enough to try the second exercise. The last and the third exercise is side planks with knees straight. Start by lying on your side, similar to the second exercise. Support your upper body with your forearm, straighten your knees. You can stack your feet together or stagger your feet. If you choose to stagger your feet, you can put the bottom foot in front of the top foot. Lift your hips off of the floor and then push your hips forward. Make sure your back is as straight as you can. Hold this position for up to 30 seconds and then come back down to the floor to rest. Switch sides and repeat. If your pain increases when you do this exercise, you might consider going back to the second exercise to practice for a couple more days until your obliques are strong enough for the third exercise. If you want to completely recover from your low back pain and you still haven't visited your local physical therapist or physiotherapist, please visit your local physical therapist or physiotherapist for a personalized rehab program. If you found this video helpful and you want to learn how to strengthen your core in either the supine position or the plank position, please check out the videos that I made for those topics.